We are still in this pandemic, and we know there are still strains on the healthcare system. And as we come together more frequently with more people, the virus has more opportunity to spread, and we are seeing that.
A word of caution from BC's top doctor during the province's first pandemic update in more than a month, when the last broad COVID restrictions were lifted. COVID hospitalizations steady but high, 550 at last count. Infections holding around a couple thousand, confirmed new cases each week. Healthcare staff not escaping illness.
This week we had between 17 and 18,000 people who missed at least one day.
That's similar to the number of sick in January. Basically, they say this is a reprieve for BC between COVID-19 surges right now and for the next couple of months, but the risk remains.
So we do need to be cautious as we go through this, and we need to be prepared that we're going to see a surge in the fall. And there are things that we'll have to go back to remember about how we can do that.
She says that will require everyone step up vigilance again with protection measures to mitigate transmissions. Not saying specifically what, but that she intends it to be based on personal responsibility, not population-wide restrictions.
I hope and I expect that we'll never have to put in orders that require people to do those things, like we did when we didn't know what was going on over the last 2.5 years.
The key thing, vaccinations, strong across the province and across healthcare. The province with the latest vaccination rates there. The most and least vaccinated of BC's regulated healthcare practitioner colleges. Most vaccinated, dietitians at 98%, physicians and surgeons also 98%. Least vaccinated, naturopath physicians 69.2%, chiropractors a little over 78%, and then traditional Chinese medicine practitioners and acupuncturists at 79%. Overall, the colleges are at 94% vaccinated. The rest of the province at 85% with 2 doses, a bit more than 50% with a booster. Unlike some other provinces, BC is holding off on 4th doses for now for those under 70, unless they're extremely vulnerable.
There really is very good protection from 3 doses for most people up to age, actually really up to age 80, but definitely up to age 70.
A large number of people 70 plus in the community will be able to get 4th shots over the next couple of weeks. For now, a reminder, even if you've had COVID in the last few months, get the booster you're eligible for. Make sure your vaccinations are up to date. Dr. Henry saying these are what have and will continue to get us through.
And we only have to look at places like Hong Kong and Shanghai to see what can happen if you don't have that level of protection that these vaccines have given us. They are a magic bullet.
In Victoria, Lisa Yuzda, City News.